Isolation from friends, stress from learning in a virtual classroom, cancellation of sports, family gatherings, starting to add up to a mental health crisis among young people. Joining us to talk about the mental health among teenagers and young adults, Jessica Vance, supervisor at Provident Crisis Services. Good morning, Jessica.
Hi, thank you so much for having me.
Oh, you are most welcome. We use the word crisis. Is it that serious?
Yeah, a lot of teens are struggling with increased symptoms of depression and anxiety and thoughts of suicide.
It's so scary to even hear that. We know kids that age are vulnerable anyway, but you mix in the pandemic and the restrictions. What are you seeing recently that is of utmost concern?
Probably increased isolation and lack of a routine. Those two things together can really impact a teen's mental health and increase symptoms of mental illness that they may already be struggling with, or it can cause some symptoms to begin that they weren't struggling with before the pandemic.
So if mom and dad maybe is noticing something a little bit different, what are the signs to look for?
Signs to look for are lack of interest in things that they were interested in before, like spending time with friends or family or participating in certain events that they might finally get the opportunity to participate in. And isolation, maybe irritability or mood swings that weren't there before. So anything that is a difference from their norm that is unhealthy are definitely things that you would want to keep an eye out for.
But if somebody is struggling, they might resist talking about it. So what are some of the things we can literally say to a young person? How can we gently bring it up?
I think that it's important to be gentle and direct at the same time. So it's important to be gentle in your tone of voice and to communicate that you're not going to get mad or frustrated if they answer in a certain way, but you do need to be direct with how you ask questions and you can't beat around the bush. So it's important to ask, have you been feeling depressed? Or if you're concerned about suicide, have you been feeling suicidal? So it's just very important to be clear with what you're asking so that the teen or child feels like the door is open for them to talk about what they're experiencing.
Yeah, but some adults and parents might be having trouble with the pandemic and isolation as well. So is there a way for moms and dads to kind of lead by example here?
Absolutely. I think one way that's really, I don't want to say easy, but a simple way that parents or caregivers can lead by example is by establishing a healthy routine for themselves. Something that has been thrown out of whack this year that has caused people's mental health to take a big hit is lack of a routine. And routine is so important for people's mental health, especially kids. So if parents are still continuing to work out and go to work and get up when their alarm goes off and cook dinner regularly, that example will really say a lot to their kids.
And help is always just a phone call away, and we'll make sure we put it on our website. Thank you for joining us, Jessica. It's Providence 24/7 Crisis Lifeline, 314-647-4357, or you can go online to providentstl.org. Some important information.